Vaccination rates have seemingly plateaued in the U.S. even after full FDA approval was granted to the Pfizer COVID vaccine. 26 states are offering various incentives, from money to marijuana, free food to free beer. Just yesterday, the mayor of Little Rock, Arkansas, announced that the city would offer $50 gift cards after each dose of the Pfizer or Moderna vaccines. And if you decide to get the single-dose Johnson & Johnson shot, well, you get a $100 gift card. But how effective are these incentives? Associate Director of the Center for Health Incentives and Behavioral Economics at the University of Pennsylvania, Harsha Thirumurthy, is here with more. Thirumurthy, I hope I said your last name right. This is a very interesting area of research, particularly now. So explain what your research found when it comes to these financial vaccine incentives, giving people a beer or, a chance to win $1 million. Is it working?
Yeah, good morning, and thanks so much for having me here. So my colleagues and I at the University of Pennsylvania and the University of Chicago, we took what I would argue is a very simple approach, which is we looked at the time in July, there were 24 states that had introduced some type of statewide incentive program. And we did a very simple comparison, which is we looked at the trends in the daily vaccination rates in these states. And we recognized that over time, the vaccination rates in the US were declining every day. So the number of people getting vaccinated has been on a steady downward trend for at least for a long time. And so what we did is we compared those 24 states that did have these incentive programs to the other 26 states that didn't have any such incentive program, adjusting for a lot of what was happening in the background in terms of national trends. And what we find, the bottom line here, is that at least for these statewide incentive programs, there was no effect on the daily vaccination rates, which means we did not see more people coming in to get vaccinated in the immediate aftermath of the introduction of these statewide incentives. And as you said, a lot of these incentive programs, they had many different forms. The vast majority of them were what we call vaccine lotteries. I believe something like 18 of these 24 states introduced vaccine lotteries, and then a few states had these smaller incentives like a free beverage or a free entry into a state park. And then there were a very limited number of states that had these types of what we call guaranteed rewards. So like the one that you just mentioned in a city, so $50, $25, even $100 for getting vaccinated. But the bottom line is that it does not seem to be, at least at the state level, a very effective way to motivate people to get vaccinated.
So I guess this is the question on everybody's mind, especially folks who have been vaccinated. And let's say you have someone in your family who doesn't want to receive the vaccine. What would incentivize people to be vaccinated? And again, this is, I understand, and I think it's important, and Emery and I have done this quite often to remind our viewers that this is not, the best method of trying to get people vaccinated is not to shame them or condescend to them or to ask them what's wrong with them, but to try and hear them and understand where they're coming from and why they feel the way that they feel. Because I think in my mind, well, dying or ending up on a ventilator is incentive enough. It was incentive enough for me to get vaccinated. I didn't need the money, the free Krispy Kreme, the free hot dog. But
you took it anyways. Let's be honest.
If they're giving it away, I'm gonna go get some, right? I'm only human. But what would incentivize?
Right. So that's a terrific question, and indeed, for many of us, it wasn't the case that an incentive was necessary. But clearly, for a large number of Americans, there are a number of factors that are getting in the way of going for a vaccination, and we think that a lot of different forces are operating on people's lives. So one is they're being exposed to a lot of different messages through the media. They may be getting misinformation about the effectiveness of vaccines or some of the dangers associated with them. They may also have other constraints that are related to their day-to-day lives, whether it's about getting to work or being able to take time off to go for a vaccination dose. So we think that one reason why our findings overall were somewhat disappointing is that these lottery incentives, although they've had a good track record in other settings, it may be the case that at the state level, when you say that there's going to be a few people who will get, say, $1 million jackpot, that some people look at that and say, well, the chances of my winning that are very low, and perhaps that's contributing to relatively limited effectiveness. So I believe, even though we do feel that there's some rapid research that's necessary, I believe that we do want to see more of these guaranteed rewards being provided. And I think the prospects for those types of incentives having more effect actually are much stronger. And indeed, I think it's encouraging that in the Biden administration, one of the recommendations they've made is that states offer incentives along the lines of $100. I think that's likely to be slightly more effective than the lottery incentives that we've seen in many cases. And just the other point I want to make is that our research is not sort of the final word on whether incentives are effective or not. We're looking at these statewide programs, which is quite possible that people have not necessarily heard about them. Maybe there isn't sufficient marketing of the promotion of the campaigns. So it's quite possible that at the city level, when a city introduces incentives, or maybe even employers introduce incentives, and you have local leaders who are promoting the existence of these types of incentives, that we'd see slightly more promising results. But indeed, as you say, there's many factors that are getting in the way. We definitely are not claiming, or we don't believe that incentives alone are going to be the solution here, even if it's possible that these guaranteed rewards that are larger in value will show some better results. But we think it needs to be accompanied by so many other things, including trusted leaders, going out in public and promoting vaccination. And I think especially in other research that we've done, we've found that it's particularly when you have political leaders or local leaders who in the past, say, were resistant to vaccinations or didn't promote it as strongly, if they come around and now say that this is really important, that it's worth doing, I think that message is likely to resonate more strongly with people who until now have not gone for vaccinations.
It's a fascinating topic, a fascinating discussion, Harsha. We'd love to continue talking about it more. Hopefully you'll come back and continue to illuminate us on what is really an important subject and important research. We really thank you.
Thanks.